have one viewer. Oh, Helena, perfect. Let's try. I'm adding you now. Kasia? Helena, the girls were suggesting it's because of the heat that we are having these technical challenges, maybe, possibly. Let's give it a chance. I'm sure it will work. It might not work straight away, but it will work. Okay, so I again got a message that you declined the invitation, which I know you didn't, so I'm trying again. Yes, Kasia, fingers crossed, exactly. Okay, one more time, Helena, no stress. We are here to be examples of Zen. Okay, one more time. Okay, one more time. I know, Kasia, it's really interesting, but sometimes this is the case and we don't know why. Helena, you see it work. Thank you very much.
Hello.
For perseverance.
Yes.
Thank you so much. Okay, great. So
Hello.
we are live now. Hello. We have
Hello.
few viewers. Maybe I can start with some housekeeping points before we go into introduction. Thank you, Kasia. And thank you all for dialing back in, girls, because that's really appreciated. So because maybe possibly a few more people will join, I will start off with housekeeping points, and then we will move on to introductions and of course the main session. So this is a live recording, so it's live. And if there are any hiccups, it's because we are live. And let's just enjoy and interact, because that would be lovely if you ask us questions, if you give comments, if you leave us likes, if this is of value to you, because we hope we are providing value here. Also, if you can think of any friends, female friends, that what we are discussing might be of value to, friends that are interested in health and wellness, then press the share button at the bottom of the screen on the left. This will then allow you to share it with your friends. Yes, even if you are watching this video not live, but then please also leave comments, ask questions. We can go back and answer those questions. And also please share, because obviously the more we share, the more women can benefit from this, and the happier we will be collectively. So this was the introduction from the housekeeping point of view. Let me just introduce myself very quickly, and I will hand over to my guest. So my name is Ania Iwanicka. I am a holistic health coach for women, and my mission is to improve well-being of every woman I work with. Holistic health coaching is about guiding and supporting clients through making positive changes to their diet and their lifestyle. When I say lifestyle, it's quite broad. It will mean exercise, physical movement. It will mean detoxification of their environment, including cosmetics that we are using, but also sleep, mindfulness, relaxation. So the goals of every client I work with are quite unique and different, and the approach is also different, because some people are working with me because they want to lose weight. They tried diets that we know rarely work, and they want to lose weight in a more kind and sustainable way. Someone see that their children are not eating well, but they struggle to make a difference in children because their diet is not perfect from this point of view. Others suffer from some health conditions, and they know that by implementing changes to their nutrition and also their lifestyle, they will manage the condition better, they will get better, they will feel better. So there are very many reasons for this. Usually I start off with 28 days coaching program, because that 4 weeks is enough to work through very many areas with the client, but also it allows to form new habits, and I'm there to support. Health coaching is not about judgment, it's not about prescription, it's more about guiding and supporting. So on that note, welcome to the second session in the series of Better You by Ania. This series is a series of interviews with health and wellness experts. And today our special guest is Doutora Helena Justo. You can see her on the screen next to me. She's a therapist and a teacher of traditional Chinese medicine. And today we will be discussing how, through traditional Chinese medicine acupuncture, we can support women's health. So Helena, over to you, please, for the introduction, and then we will move on to questions. Thank you so much.
Hello, everyone. I don't, can you hear me well?
Very well.
Okay. So my name is Helena Justo. I'm a TCM doctor here in Portugal. I graduated here in Portugal in 2009, but I went to China to learn from them directly. And I practice here in Portugal since that time. So I attend people in the weekdays, and on the weekends I go from the north to south of Portugal to give classes about this.
Perfect. Thank you so much for this introduction. So we will move on to questions now. And Helena, I have prepared a set of questions for you. So I will be looking away from the screen from time to time, just to refer to, not to forget all the important questions. My first question is, the acupuncture method that we will be discussing today is part of what I've mentioned, TCM, so traditional Chinese medicine. Can you please tell us more about what it is, how it works, why it works?
So acupuncture is one of the most common known disciplines of Chinese medicine, but it's not the only one. And the acupuncture treats the holistic person. We in Chinese medicine, we see the person as a whole being. We arrange the physical being and also the emotional one. So the acupuncture is the way of treating the energy of the person, knowing that we have some meridians in our body that looks like some nerves, but they are full of energy. So acupuncture is inserting needles, really, really small needles, in some specific points of the body, so we can regulate that energy that we see it's not improving well, and we can treat pain, we can treat many diseases like emotional problems, immune system problems. So why it works? Because when we put a needle into the point, we stimulate some nerves that are nearby the needle, and we also make the qi. The qi is the energy flow. And for us, the TCM doctors, we think that the blockage of the energy is the main cause of all diseases. So the needles are made with steel, and we know that steel conducts energy. So we put needles in some points that we think are important. And this kind of creates a stream between the needles, and it makes the energy of the patient flow.
Okay, very interesting. So please tell us, because perhaps most of the people watching have never visited Chinese medicine doctor. So please tell us more about how do you assess a woman, because we are talking about women's health today, a woman when she comes to you for her first appointment. Hello, Kato.
Okay, so first we need to know why she's there. It has a problem. So we start with the interrogation. That's a conversation to know about that specific problem, when it happened, if it stays too long, if it has another historical issues.
Mm-hmm.
Then the interrogation can be long because we ask many questions. Sometimes people look at us and don't understand why we are asking so much questions, but that's because we see not only the disease, we see the emotional problem, the past of the person. For us, everything is important. So first of the interrogation, then we see the Shen. What is the Shen? The Shen is the glow of the face. So we see the color of the face, we see the color of the skin, we see if the eyes are bright or not, we see the color of the lips, and then we see the tongue, because the tongue for us gives us many questions about the organs, the internal organs. Then we can see or not see the pulse, but it's important sometimes to see the pulse. And then if she has a pain, a specific pain, I will check the main area to treat the pain. But if it's another condition, then all of these factors are as I ask all of these factors in the consultation, and then I do my own diagnose and proceed to the treatment.
Okay, very interesting. So my follow-up question is that sometimes it happens that our body starts giving us certain symptoms, and we may become concerned with what we feel, how we feel. We will then proceed and speak to with our doctor. Our doctor usually suggests to run blood tests, urine tests. We wait, we get the results. When the results are through, and it happens often, it happened certainly to me in the past, results come through. If they are within what is called a normal range, we are being told that actually everything is fine with us, no need to worry, there is no reason for any sort of concern, we are labeled as healthy and sent off. We leave the surgery and we don't somehow feel any better, because we know inside us that we are not 100% okay, because we don't feel 100% okay. So this is what I described is the approach of conventional medicine. Can you please help us understand how TCM would differ here? What would be the approach here, and also the, I don't know, result, if you like?
Yes. The main thing I want to explain is we observe the nature. So TCM was based on the nature of the 5 elements of the nature. So let's suppose that each one of us has a biotype. So let's look, maybe you are lung, your biotype is lung. So every one of us has a biotype. So we have to take that to consideration. And then the five elements concern to the main stations of the year, the spring, the summer, or we have to check what's not good with the patient of his biotype, what station are we in the environment, right? And then we have 5 major organs, or 6 major organs. And why don't we feel sometimes okay? Because our energy blocks in certain organs, and many times it takes too much time to get to the physical parts. So it stays on the energy parts, and then on the emotional parts, and after that, the physical part. So we have to look to the emotional parts, to the organs parts, and to the energy part. So we have to make some kind of puzzle, you know, and what station, what is the biotype of that person, what major organs are in deficiency, what other organs are in exceed of energy. So we have to do this puzzle, and sometimes you have a deficiency of your kidney energy, and it's still on your energy level, so it won't appear on the blood screen, you know. You take time, many times you take time to get physical. So that's why TCM it's very good to prevent diseases, to treat, but also to prevent.
So what you are saying, just let me see if I got it right, is that if our body is giving us some sort of symptom, but nothing is showing in the blood test, this may mean that at an energy level something started happening, so it's triggering disease that hasn't manifested yet. Is that right?
Yes.
So we can prevent it by...
Okay. Yes, that's why in China we make treatments to prevent to get ill, but here we only look for solutions when we feel sick. It's normal.
Yes, and also what I observed, again, is my personal observation mainly, is that then we look at calming the symptoms, not necessarily digging deeper into what is causing it, right? Very interesting. I find it very interesting what you described. So next, I would like to, since this is primarily, our discussion is primarily focused on women's health, I wanted to discuss something that is very close to very many women, to their hearts, perhaps even. So I would like to take one specific example, and I would, observing my friends, colleagues, I often heard about women having problems with fertility. So it almost became like a common denominator of the 21st century in the developed world. So those women very often have what they describe tried it all, including numerous IVF treatments, and still they were either not able to conceive or able to conceive but not able to keep the pregnancy. Again, I heard that traditional Chinese medicine and acupuncture can be very helpful in this area. And I would like to, I and my viewers would like to understand why is that?
Okay, as I am speaking about energy, this is the main focus of the TCM treatment. And I just make, there can be a lot of causes of infertility, but why is this happening now so much nowadays? We have one main cause, and that main cause is because, I will say a word that everyone knows, it's because of the stress. But what is stress? When we have stress, we have some reactions of our body. And for us, Chinese medicine, the much stress we have, the lower our energy gets. So this is very difficult because a woman wants to get pregnant, but she's anxious about that. So she starts having too much adrenaline, too much cortisol going on, too much anxiety. And that stress, it's the cause of not having enough energy to produce another person, you know? Because for us, TCM doctors, our ancestral energy, the energy of our ancestors, stays in our kidneys. It keeps it there. It's like genetic, as we say, genetic. For us, the energy of our ancestors, it's located on our kidneys. And our kidneys are the responsible for producing another human being, you know? So what does stress do? The stress gets to the kidneys. They take energy off the kidneys. So we have to get much energy to the kidney to produce another human being, or to have energy enough for that. So this is one of the causes, the most common one, but that can be another issues that we have to evaluate in the consultation. But we have techniques with acupuncture, with specific points, and with the therapy with plants. We have to give some plants to the woman or to the man or to both, so we can give them the energy that they don't have, because if they cannot produce that energy, they have to take it outside with plants that we think it's the better to this situation. This is an example.
Okay, so it sounds like this is much less, I don't know the word at the moment, invasive perhaps than other sort of treatments for infertility, where you take hormones and all sort of drugs.
Yes, but sometimes they really need that. But we can do the treatment at the same time. They can have a fifth, and then we can do the treatment so that the procedure went well. So we can combine both medicines, and I had some results with women, and it's the best thing sometimes to do. It's the combination of the two medicines.
Okay, so this is also a very interesting point that you touched upon here, that very often nowadays you hear, you know, a lot, you hear about complementary medicine, and then many people think that what complementary medicine is doing is disregarding conventional medicine totally. But of course, this is not true. As you just described, it's about being complementary, right? So we are not saying to people, you know, don't listen to your doctor. We are saying we are here to support your health, give you, as you described, unblock your energy flow, so your body is able to respond better to the treatment prescribed by your doctor.
Yeah.
Okay.
Yes.
My next question here is, we talked about pregnancy, let's talk about children.
Yes.
I hear that traditional Chinese medicine believes that health of a child is determined by the state or health condition of their mother. And I also heard that when you are assessing a child, you never do it in isolation to their mother. So you look at both at the same time. Am I right in this? And if I am, please tell us more about this, because it sounds really fascinating.
Yes, because as I was telling you about the kidney energy, when we are a baby and when we are living in our mother's womb, the energies are still really very mixed together. So when a baby is born, he has his own energy. The mother stays with her, and the baby has his own energy. But in some years, sometimes the two still have a lot of similarities. So we have to treat some diseases of the baby can be passed through the mother, and not just the genetic part. I will give you an example. If the mother suffered some kind of loss in her pregnancy, if she was sad because someone died, for example, in her pregnancy, the baby can be born with respiratory problems, with lung problems, you know, because the lung and the intestines, but more the lung, it's really connected to the sadness. So if the mother has some kind of sadness in her pregnancy, the baby can be with this kind of problem. So this is an example that we, in the first years of the child, we have to address the both to see what we can do. And if we want to treat a child, we always treat the mother and the father because it's really important.
Amazing. So you see, this is in a way similar to what I do in my practice. That when women want to change diet or improve well-being of their children, they really need to start with themselves. This is really, and this is what I really like in these complementary approaches to medicine and the holistic approaches. So we spoke about children. Now let's talk about women exclusively. We as women would love to be able to preserve our youth appearance for as long as possible, ideally through our lifetime, but of course we want to live a long life. So because of this, very commonly these days, women do get Botox procedures. However, we know that Botox is basically injecting a toxin into our faces, and that toxin freezes the muscles, and then we think we look nice. It doesn't always look nice, but we think we look nice. So again, my question is, does TCM acupuncture offer an alternative, something that would preserve the youth appearance, but at the same time protect and preserve our health as well?
Yes. Yes, if you look to the Chinese women, they look very young because they are really connected to the beauty since the earliest days. Because they have some, I can give you an example, they have some beauty creams of pearl creams that can help really the face to be juvenile for many times. The acupuncture has specific techniques to treat the beauty, the wrinkles, and the other issues regarding to the beauty of the women. And then we have the plants. I give you an example. We have a mushroom in our Chinese medicine that we say it's the mushroom for longevity, that if we take that mushroom, we can live to 100 years. So it's not really like this, but it's true that in China, in some parts of China on the mountains, when they get this mushroom, they live until the 100 years and they have good health. So it's a combination of factors, the acupuncture, the treatments of some creams, and the herbs too. Of course, sometimes it's not as quickly as a Botox, but at least it stays for much time and it's less dangerous.
And it looks probably more natural, right? If it's our own face rather than our...
Yes.
Okay. Yes, that's very good. I'm sure all women watching are very happy with this answer, and I'm sure very many of us, me including, will try to benefit from this. So, because you've mentioned herbs and mushroom, as we were speaking now, please tell us more about what exactly about this, because my next question was going to be whether traditional Chinese medicine is all about acupuncture, or whether it uses any sort of supplements. Yes, please tell us.
The acupuncture is one of the most famous subjects of the TCM, but the TCM it's really large. We have the acupuncture, we have the tuina. The tuina, it's a massage, a therapeutic massage that we use to unblock some muscles to treat pain. And we have the tuina to treat the pain, and then we have the tuina to treat children. As we cannot put, we don't do so much this in Portugal, to put needles in one baby of 1 year, right? So we do tuina to the baby to stimulate the points that we do with needles to an adult, for example. And then we have the moxibustion, that is a plant that comes in a cigarette, and then we heat it, and we can hit some points to give energy and to make the energy flow. We have the cupping therapy, that's like glasses that make some negative pressure in the body. People like the effect, but they don't like how they appear, because sometimes it can make a bruise, a large bruise, but it's very good for pain and for respiratory problems. And then we have the plants. It's a thing that we almost do every day. to treat with plants, because if your energy is low, the thing that will make your energy fullest is the taking some plants or mushrooms, and it's the phytotherapy.
Okay.
Wait.
So discussing when you were talking about cupping I think became very popular a few years ago because celebrities suddenly started to use it, and I remember Michael Phelps during the Olympics had obviously bag full of, and I have to say that in Poland, for example, cupping has been very popular since I was a child. So I remember receiving this treatment as a child, and I have to say nothing cured colds or lung infections as well as cupping. But you've mentioned plants, and I would like to ask additional question here, because many people worry that, oh my goodness, I'm gonna take some plant from China. What is this plant?
Yes.
So can you please tell us more about how safe these plants are and where they are produced and how they are, whether they are certified and how safe they are?
Yes. Here in Portugal, we have a law that we cannot produce or to give patients some original plants. So I will explain like this. Every plant, we make a combination of plants. We don't do the plant as simple. We cannot do that. We have to go by the law, and the law says that we have to do some composts that has the plants and the graduation of the plant, and that everything is made on a laboratory, like a pharmaceutical laboratory in the Netherlands and other places. So we don't do it in Portugal. They come already with everything tested, and they are made in laboratories, so they can be safe, completely safe. So the laboratory is the one responsible to see how the plants are being treated and where they are getting them, because of we have to make sure that they don't have pollution or toxic elements. So it's really safe, the plants that we give here in Portugal, because we cannot do it by ourselves. We can take the prescriptions that are made in the other countries of Europe and that are arriving here in Portugal completely safe.
Well, we have obviously viewers here, and we will have viewers watching the recording from not only Portugal but other countries, mostly European Union countries. UK is still European Union today. So I would assume that it's similar in those countries, in other European Union, because the law is
in every European,
Okay, so we are safe to do this. So that's really interesting.
Yes.
Thank you for clarifying. Now, let's say, okay, one decides to come and see you. How quickly can one start noticing a difference in the way they feel, or in the observing symptoms? Coming down, feeling better, getting more energy, but in general, noticing a difference.
Yes, it's not easy for a therapist to give that kind of answer, because it depends of the person, it depends of the situation. If we are talking about a pain, a specific pain, we have in 3-4 sessions, we have to see results, because if we don't see, something is not getting good. When we talk about immune system disorders, here we have to be a little more patient. So we cannot take fibromyalgia in 4 sessions, or some arthritis in 4 sessions. But in the first sessions, the patient can feel really calm. They can feel some symptoms change, like they can sleep better, they have more energy, they feel like they can go easier to the bathroom, they have appetite. So a few things that when we talk about immune diseases, the things that really important, that the sleep, the energy level, so that kind of things can really have to change in a few sessions. The other things take time. It depends of the immune system of the person, and if they do what we ask them to do, because that is important also.
Of course.
If they do the homework.
Exactly. But because you've mentioned immune system here, I will ask one additional question because it seems a plague of 21st century, the autoimmune conditions, right? They are seen on
Yes.
the level never observed before. So very common at the moment is the Hashimoto, which is a thyroid, autoimmune thyroid disorder, but also
Yes.
multiple sclerosis seem to be on the
Yes.
rise. Another rheumatoid arthritis. So in general, and I would like to hear more about how TCM can help and how can it support that, because sometimes people do have to receive a treatment from obviously doctor, and they do, but how we know it takes time, right? But I hear
Yes.
that it actually does make a difference, where that it's not only no longer about managing the symptoms, but Chinese medicine can actually help to heal the body.
Yes. So the main cause I will talk, it looks like I'm talking about the same, but for us is the main condition nowadays is the deficiency of the energy of the kidney. I will try to explain like this. The kidney is the main energy of our ancestors and is the one that regulates our immune system.
Okay.
So if my energy of the kidney is low, I will probably have a problem about my immune disease, okay? And another thing that's curious, it's the kidney rules the immune system, the nervous system, it rules the hair, for example, the gynecological problems, you see. So the bones are the kidney, it's ruling the bones. So everything you talked, we can relate to kidney. So we have to do that kind of analysis, and we have to tonify the energy of the kidney. And why is this so bad nowadays? One of the causes is the stress we have. It's impossible to live like this. We have to do the best in our job. We have to do the best in our house. We cannot take any vacations. We have to always be smiling. This is really, really bad. And there's another thing that in my practice I've been watching. It's every immune disorder has an emotional side. So this kind of immune diseases, when I ask the patients, they always remind some event of their lives that was really bad. And that event made some difference in his immune system or hers and his emotional side for us. So what are the main things? The low energy of the kidney, the emotional side, the stress, and one big factor is what we eat. This is very important. We eat really bad nowadays, and that makes a difference.
Okay, so with your answer, you led me very nicely to my next question, because I was going to ask how we can, in our daily life, because obviously, you know, even if one decides to come and see you, this is not every day. So how in our daily life can we support our health? And you mentioned kidney. I know another very important organ. You mentioned lungs, but I know another very important organ is our liver. So how can we, through what we drink, what we eat, support these organs so we take care of our health with these principles of traditional Chinese medicine every day, not only on the days when one comes to see a therapist?
Yes, that question we have to be really careful, because as I told you in the beginning, every person is a different person. So what we change in the diet, what we give them to take, it's different for every person. I give you an example. Here in Portugal or in London, we go and take a tea, and everyone drinks the same tea, you know. In China, that is not possible. You have your own tea with the plants you need. I have my own tea with the plants I need. So we have to really be careful to what we are taking, because even a plant is really good for the liver for someone, but for another one can be toxic, you know. But one thing that I say that everyone could do, it's just a little change that the Chinese all do always. It's to drink warm water, always. In China, they don't drink cold water, never, never in heat, never. So I never drink cold water because it makes our energy stagnate. So we don't have energy with cold water. We need warm water. So that it can be an example that can be for everyone. Not stop drinking cold water. It's good for you.
And I hear that when it comes to food, another principle that can be applied again to everyone is to have warm food. So food cooked on fire. Is this rather than, yes? Mm-hmm.
But we have to be careful that sometimes if you have too much heat in your body, you have to take some food, some raw food, or some food that is refreshing, you know.
Okay.
And other times you are the same person, but you have a different condition, and it's a different station of the year, so you have to take the same elements, but you have to cook them. So it also depends of the person, and if it's the same person, it depends of the condition, you know, because the properties of the nutrition, it depends. If you take a carrot raw, it doesn't taste the same that a boiled carrot. So
absolutely,
that's the difference.
And it's totally digested very differently by your body and does a very different thing. So I like this answer because, again, this is very similar to and very close to my heart when it comes to my professional life, because very often we hear nowadays people discussing what is good to eat, what is not good to eat, but really it really varies because people digest carbohydrates in very different way. People respond to fat digestion in very different ways. So it's and this is why it's so important to be very focused on a particular patient and take into account their whole environment rather than just the fact that they want to lose weight.
But there's one thing that the Chinese didn't take until a few years ago. That's sugar. I went to China and there was no sugar in China. No sugar, no milk, and no coffee. So for us, this has a connection because when I was in China, now I know there is sugar, but that's why they are different. I didn't see any obese Chinese, and then they are. Now they are Chinese that are obese. And one of the main things is in China, they don't eat sugar. So that makes a huge difference because we know in our days that the sugar, it's the principal factor of the immune alterations, the cancer problems. So this is the main thing. I didn't know any case of breast cancer in China, for example, because they don't have sugar or milk. And this is the main things here to change, I think.
Yes, just yesterday, I was listening to a very interesting podcast. The guy is a researcher and he wrote a book about sugar. I don't remember his name at the moment, but he was talking about exactly this, that out of everything that we consume, sugar is the worst thing, absolutely damaging substance to our health.
Yes.
And he was also talking about this approach. I remember, so I qualified as personal trainer about 6 years ago now, and at the time at school and that was that I went to the considered best center for personal trainers in London, And at the time, they were still teaching us that it's if you want to maintain your slim silhouette or if you want to lose weight, it's basically about calories in versus calories out. You cannot, and we all know what it means. It's about burning the calories you consume.
Yeah.
Yesterday, the guy again was talking about this because he said this is probably the most deceiving piece of information out there.
Yes.
Because the spoon of sugar, so the whatever calories it equals to, and the spoon of olive oil have completely different
Yes.
influence on your
Yes.
body. One obviously generates a huge insulin spike, and we know that insulin is responsible for so much. We all need insulin, but that constant spike is responsible for so many diseases nowadays, and obviously this plague of the diabetes type 2. And you know, the olive oil will not even touch our insulin response, right? So so this is very interesting, and I think that this is something that I would like to repeat to all my clients and friends and family who are not always listening, but that sugar is the main problem. And honestly, if you want to do one little tiny thing that will make a big difference to your health, get rid of sugar. And I can assure everyone that your body really stops liking sugar once you stop having sugar.
Yes, it's an addict. It's an addiction.
I'm not having sugar. It is an addiction, Helena, but I think that's at the kind of our, you know, psychological level. It's like they say with heroin, and then you have obviously physiological level addiction as well, and you also have the what we know is called get rid of sugar, exactly. The candida that form in our intestines or in our digestive tract, and they feed off sugar. So obviously, as we are having sugar, they multiply and we need more sugar. When we stop sugar, they die and the craving stops. I mean, this is us discussing this in a very, very simplistic term. And also, you know, like nowadays, the only sugar I have is 85% dark chocolate. And when I do have something sweet, the other day I had ice cream. They were so awfully sweet. I really didn't like them. And it's super. I went for the smallest cup of ice cream that was available. And just a year ago, or maybe a year and a half ago, I would always go for the largest one. And it wasn't sweet enough. So this is, I'm talking about this just to give people kind of this reassurance that it's by no means deprivation. You really, it's like being a smoker, stopping to smoke, and then not remembering that cigarettes exist. Xylitol. Well, xylitol, I don't know, Helena, do you want to say anything about this? About like xylitol is not really artificial sweetener per se. It's not like aspartame. It's natural, right? But anything about this? Do you have anything?
The things that we substitute to sugar, the problem gets a little bit the same. It's the high insulin level that we can take drastically in our system. And for us, the sweet, it goes directly to the spleen, to energy. This is energetic, not physiological. For us, the spleen and the pancreas and the stomach react too much to sweetness. So they need sweet, but the sweet they need, it's from the roots, for example, the sweet potato, you know, the beetroot. So it's not the sweetness, and we can live without this, but we have so much since child that we are experienced to, oh, take a sweet because you've been well. So our body reacts to the knowledge that we have. So but the problem is not only the sweet, the bread has sugar. Almost everything nowadays, if we are looking at processed food, has sugar all over. So it's really difficult for us to take that completely.
Yes, and I would also, because you mentioned children and us giving sweets to children, and I would like to, like wherever possible, I try to spread this message. Let's try to really be responsible and not give children sweets. Like, we can make a difference. I'm not saying, you know, parents can do whatever they choose to do, but going to visit friends or family who have children, really, you know, let's not go and give chocolate, because also you know, parents may not like it, and child receives this and it creates all sort of problems. Just this Saturday, I was going with my partner to visit his friends, our friends, and they have children. And I went and bought a big container of blueberries. And he looked at me and he said, "You know, in Portugal we don't give fruit to children. It's a bit weird." And I said, "Okay, but I do." So we ended up going with this as a kind of, okay, bottle of wine, blueberries, da 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 da. And the children, you should see them, immediately jumped at the box, and they were eating this like with hand, because it's sweet, it's nice, but it's healthy. So again,
but it's healthy. It's
exactly.
better.
So Kasia, just to go back to your question, it's not very often people replace sugar with another sweetener because of the calories. But calories are not as much of an issue as it is what the substance really is. Like aspartame, apparently, the way our body interprets aspartame, and I'm not a chemist, so of course I'm talking again, I'm simplifying, but apparently our body recognizes the substance as, you know, few times sweeter substance than sugar, and pumps so much insulin to deal with this that it's, you know, that it's very problematic. That's why people who consume Diet Coke on high scale, they do get
Not good.
a lot of
it's
problems.
a problem. It's a problem.
So this is almost like, I feel like I can, you know, talk about sugar, because there is it's fascinating subject. It's so, Helena, maybe one day we should do something about sugar only. Let's move on to what we were talking about earlier. So I would just like to I would like to understand, because people watching this webinar, let's call it webinar, will some may decide that they want to give it a try, right? They want to give Chinese medicine a try, acupuncture a try. So can you please tell us, because you are not only a therapist, you are also a teacher, so you work with very many therapists, and you train therapists. You are probably the best placed person to answer this question. How would one go about looking for a good therapist or Chinese medicine doctor? What to look for?
It's not easy to answer that, but the main thing, I think, it's how I get my patients. It's by telling one another. So it's for me, it's not really a good thing to go to the internet and see, oh, I will take this doctor, this TCM. It's always better to talk with someone that had already gone and had some results and is happy with the diagnosis and with the treatment. For me, it's the best publicity. And then when you arrive at the appointment, it's a thing of energy, you know. If I am a patient, I would like my TCM doctor to be ensured that he knows what he's talking about. He makes the right question. He makes me feel comfortable. He explains the treatment. It's very important to explain what is going to pass, how the needles are made, what can you expect, it's going to pain, or if you're not going to have pain, all of this. But the main thing for me is please look always for someone that had already gone there and has the best opinion and had been treated for some reason. It's the main thing for me. This thing.
So I think one, and I would agree with you on this one, but also I think another good way is to speak to people in the other specialists, right? Because we all work in partnerships, in networks. So for example, the way I found you was through a person who is physiotherapist who uses this trigger point therapy and used acupuncture on me before. And then I asked him, I thought, look, you used it to help with my hip problem when I sustained an energy through running. And he said, look, I don't work on general health, but I can recommend you the best one. And he recommended you. So that's how it worked. We have a question from Kasia, and she's asking how many acupuncture sessions should one take in order to see results? Over to you, Helena.
That depends, Kasia. It depends of the situation of the patient. If we are talking about a pain that appears in 1 week, you can expect in 1-2 sessions that you will be really better. But if we are talking to a cancer condition, to an immune system condition, then it will take more sessions. It's for us therapists impossible to say to the patient how many sessions, because it depends of many things. What I do every week when I receive my patients, it's to acknowledge how was the week, how they felt, if anything changed, and then I change the treatment if I had to. And if in a lot of sessions I don't see the effects I want to see, I'm the first one to talk about with a patient about a colleague that maybe can be more osteopathy or another homeopathy or another thing that can have another result. But this is really difficult for a therapist to say. But as I was saying, a pain, if something looks, if it's a pain, we can arrange it easier. If it's an immune system disorder, an anxiety disorder, it will take more sessions. It's normal.
And again, it's also what you said earlier, that it's not acupuncture alone that will make this difference. The acupuncture will definitely do what you described, will clear these energy pathways, but what you do, like, will you actually go home and drink warm water to support your body?
Yes.
Will you take the supplements you are suggesting? Will you try and relax, right? Because a lot is about stress management. So yes, everything is very individual, and as I earlier said, also what I see with my clients, people. I remember when very many years ago when I first went to UK and I started working at the dental practice very many years ago, 18 years ago. And the thing then was, the big thing was teeth whitening procedure. And I remember patients asking the dentist, how white will my teeth go? And he said, you know, it's like you asking me, saying to me, I'm going on holiday next week and I will be on the beach. How brown will my skin turn?
Yes.
He said, unique, and we are, and this is why when we are talking about diets, you know, we need to do our own thing, because the fact that one person is eating carbohydrates and it's healthy and fine doesn't mean it's their body type. It's their, you described that Chinese medicine recognizes different types as well. So it is very different for all of us. Okay, and so I think we kind of broadly covered everything we wanted to cover, but what I'm trying to do in these sessions with the health and wellness experts is I'm trying to challenge them at the end of the interview to share some tips, to leave our viewers with even 3 tips, something that will be easy to implement and something that can be implemented immediately to make a difference to how a person is feeling. Okay, one of course can be find a good acupuncturist, right? But and easy to act on. But what would you say, Helena?
Another thing that can be common for everyone, it's drinking warm water, as I told you earlier. It's a change that it will help everything, our energy level, our intestine transit, our diarrhea, our urine problems. So it's a good thing for everyone, warm water.
Okay.
It's not, it cannot be really warm, but warm water instead of cold
Room
water.
temperature. Mm-hmm.
Yes.
Mm-hmm.
Try not to drink things with gas, with soda. It's really bad for your kidneys, right?
How about lemon?
Lemon, it's good.
Okay.
But the soda, the things with bubbles, you know, it affects our kidneys, so it's better to stay away from them.
And
And
I
then
like Agua das Pedras so much. So
no, that's the one that's good. That's
okay.
the one that's good. Okay,
Naturally.
the other ones, yes, yes. And then a thing that I will tell everyone that we learn in China is we should have a breakfast of a king, we should have a lunch of a prince, and we should have a dinner of a man on the street. So we do everything wrong. So we eat a lot at night and a few in the morning. So in Chinese medicine, they eat in China they eat soup in the morning, and it's one of the best things that we can eat in the morning: soup, eggs. So if we have this kind of things in general and stay away from sugar, if we can do this, better things will come.
Amazing, amazing tips. I really like those tips. Perfect. Helena, I cannot thank you enough for your time. It was a great pleasure to talk to you today, and I myself have learned a lot. As I said at the beginning of this session, and Kasia, thank you for asking questions. Please do put comments and questions in the comment section, because we will be posting, I will be posting this video now on my page, and Helena will have it on her page. And we will be going back to check if there are any questions, and we will be very happy to answer them. Also, if you have, thank you, Kasia. Also, if you have any friends, colleagues who you believe can benefit from hearing about what we were discussing, please share this video with them. And what else? Helena, as she said, she's based in Lisbon. So for people based in Lisbon, in Portugal, you can contact Helena and arrange an appointment. And I am, for me, it's a bit easier because obviously I don't perform any physical treatments. So I mostly work online with my clients. And I will post the link to my website in the comment, and I offer 30 minutes complimentary consultation. This can be arranged online, so please visit my website and leave your details there, and I will get back to you. So Helena, once again, thank you so very much, and thank you to all of our viewers for your time. We definitely appreciate your presence, and yes, till the next time. Thank you very much.
Bye bye. Thank you.
Bye bye. Bye.